In this week's Cardiology Countdown, we have an interesting study of peripheral arterial disease, a meta-analysis in JACC on the use of coronary CT angiography, and two studies with rivaroxaban, a new study on venous thromboembolism prophylaxis. So to begin with, there's a randomized trial looking at the ACE inhibitor ramipril on walking distance in patients with peripheral arterial disease. It was a study of about 200 or so patients where patients were treated with ramipril or placebo for 6 months. And after that period, they were able to walk pain-free for an additional minute and a quarter and walk an additional 4 or so minutes and had better physical functioning score according to quality of life scores. And so a very interesting study that suggests ACE inhibition may help on the symptoms of PAD in addition to being preventive of cardiovascular events. Next up is a meta-analysis in JACC of 4 randomized studies that have looked at the use of CT coronary angiography in the emergency department for patients with chest pain. This, as you know, is an alternate to stress testing that's been a standard for years. In 3 out of the 4 studies, there was an improvement in length of stay and a reduction in costs, the length of stay reduction was seen actually in all the studies. And so there was no difference in clinical outcomes in terms of death or MI, although a higher rate of revascularization and coronary angiography was seen, with just 6 versus 4% undergoing coronary angios when a CT angio was done. And so this meta-analysis shows that CT angiography can be a way to expedite care of patients with low-risk chest pain in the emergency department. And the number 1 pick is the Magellan study published in the New England Journal that looked at 8,000 patients who were medically ill and in need of venous thromboembolism prophylaxis. It was a randomized study between enoxaparin 40 milligrams sub-Q once a day, a prophylaxis dose, as compared with rivaroxaban 10 milligrams a day, and it was a double-blinded study. Through 10 days, rivaroxaban was seen to be non-inferior, so equivalent rate of venous thromboembolism, although the risk of bleeding was higher, 2.8% versus 1.2%. Then there was an extended phase where it was rivaroxaban versus placebo out to 35 days, and the extended duration was able to prevent further thromboembolic events, about a 25% reduction, 4.4 versus 5.7% during that post-discharge period out to 35 days. But again, the risk of bleeding was about twice as high overall. And so a new option in treating with an oral agent for venous prophylaxis with extended benefit, although with a risk of bleeding. So for this week's Cardiology Countdown, I'm Chris Cannon.